ailments. And this is kind of cool because, I mean, I don't know about you, the number of people who have colds is down dramatically. I don't hear people sneezing. I'm not, the normal runny nose on the sleeve.
That's a great impression that day.
Isn't that good?
You could be one of these actors that go on to be patients. Like, this is actually a career.
Really, I'm okay. It's when you see kids blow their nose into their sleeves and then wipe it. That's the one that.
So one of my very best friends ever, and something I've never ever let her live down. She came to our house. I mean, she was only really young, but like, as I say, I still bring it up to this day. And we're talking about 30 years ago, so only little. She blew her nose took a sock off, blew her nose into a sock, and then put a sock back on. And my mum said, "Hannah, do you not want a tissue?" And she was like, "No, I do it all the time, Sue."
Oh, man.
And this is the same friend that I've sat in school and she just wiped her nose on my arm. This podcast makes it sound like I'm surrounded by very disgusting people.
Well, you're surrounded by an eclectic, interesting group of people. That's clearly
You've
it.
met one of my friends, so yeah, you can say that with confidence.
So when we talk about seasonal illnesses, what are we talking about? What comes to your mind?
Right. So the reason I think it was my suggestion a few days ago that we might bring this up as a topic for a podcast. And everything that you're saying is correct, like colds and flu. And actually the figures for those have gone drastically down this year because of the measures that have been taken with restrictions in air travel and with people staying behind closed doors and not socially mixing as much as we used to. And also we're not engaging in things like buffets and things like this. So we've not got sort of that spread of air droplets, people are wearing masks. So, that's one side to it. But I think the side that I was thinking of a little bit more was there's an awful lot of data coming out in the UK to say that the hospitals are massively overrun. And now, I'm sure that COVID is playing a huge part in that. And, that's not to belittle anything that's going on or being said about COVID. But at the same time, that is the situation every single year. I've never done a shift in A&E in England in the month of December. And we've not had a situation where ambulances are having to be rerouted over to hospitals or we're bed blocked, which means the beds are completely full. Yeah. And it's because you tend to get in the cold winter months. And I don't mean the cold winter months of Dubai. I mean the cold winter months of Canada, James, or of the UK. You get people that are more ill. And I just thought it was something that might be interesting to talk about. And the ones that, really hit my mind are pneumonia, asthma exacerbations, people that come in with significant pain from their arthritis, people that have got what we call an acute exacerbation of COPD, which is a long-term lung condition usually from smoking. As I put on our forms today, like 95% of these people are from smoking. And also like a lot of people admitted into mental health institutes as well because they're suffering with seasonal affective disorder. And these are the sorts of things that I think about. So coughs and colds, of course, that's what we see when we sit on the general street, but there's also more serious ailments as well that come, and they tend to come at that time of year when we're preparing for Christmas and even worse just afterwards, and I say even worse because January and February are quite depressing months. There's nothing, there's not as much to look forward to.
The folks that you're talking to in the field back home and that, they're still seeing obviously the pneumonias, they're still seeing the bronchitis, they're still seeing the COPD, they're still seeing the arthritis related things coming in.
Well, because a lot of the driver behind it is the cold weather. And you might get slightly less cases of pneumonia and more COVID situations coming in. But the fact is, if somebody's getting the exposure to the COVID virus, they're also potentially getting that exposure to a pneumonia as well. And these people tend to be, not everybody, but they tend to be predisposed to getting them. So anyone can get a pneumonia. And sometimes people get a bit confused as to what a pneumonia is.
Yeah, because I am confused because I've heard the term pneumonia. I've heard the term walking pneumonia. And it tends to be people who are a little bit older, but it doesn't discriminate pneumonia. But, at the end of the day, if someone said to me, James, what's pneumonia? I kind of look at them and go, you got me.
It's funny because a lot of people will say I have a chest infection, but yet we'll put much greater emphasis on saying I've had pneumonia, as in pneumonia is so much more serious than a chest infection. And actually, although there is a particular bacterium that will cause a certain type of pneumonia, I kind of, in my head, And I think in a lot of medics' heads, we kind of group the same together. If you've got a lower respiratory tract infection, which effectively means a chest infection, that is effectively what we're referring to as a pneumonia. And pneumonia is an infection of the lungs. And as I say, there are numerous different bacteria that can cause a pneumonia. Some of them more common than others. Some of them are even a virus, like Haemophilus influenza.
Okay, so hold on a second. So pneumonia is caused by bacteria.
Usually, yeah.
Usually, okay.
Normally, the one that you would tend to see would be a bacteria, but you can get sort of a viral pneumonia as well. But usually when we talk about pneumonia, sort of just generally usually referring to a bacterial infection of the lungs. But as I say, it can be viral, and you can get atypical type pneumonias, but it's infection of the lungs, usually bacteria, and then to split that into two, what we would typically do is you've got a hospital acquired pneumonia and you've got a community acquired pneumonia.
So one I got in the hospital, one I got in the community?
Yes.
The hospital's like the gift that keeps on giving? Like, come on.
It's just because it's just a pneumonia that tends to live in hospital environments. It's normally more serious than community acquired pneumonias.
Hold on, I got a question.
Yeah.
So
yes,
aren't hospitals the cleanest place on the planet? Like, they know they've got staph infections. They know they've got, super bugs. They know, and I don't mean little cockroaches. I mean, super bacterial things that are shouldn't they be the place where there's enough Javex or, being poured everywhere? Aren't they the cleanest places on the planet? How can I be getting pneumonia in a hospital?
They're the cleanest and the dirtiest places on the planet, James, because on one hand, they are, there are cleaners going around all the time. I personally think it depends on what hospital you're in. It depends. In one way, it's absolutely wonderful to have people in separate isolation beds. But from a nursing perspective, a nurse can't keep tabs on a patient. So in another way, it's a little bit more dangerous to have separate isolation beds. So one, great, reduces the risk of infection spread from patient to patient. Secondly, bad, because how can a nurse keep tabs on everything that's going on? How can I constantly see if this patient's starting to show signs of respiratory distress, or otherwise they can't? They have to just keep going in and out at regular intervals. And even though they've got an alarm button, some people feel like, I don't really want to disturb the nurses, or, or might not be able to reach it for whatever reason at that time. So in one way, very clean. There's lots of cleaners. They're using the real rock solid sort of disinfectants there. But in another way, because they do disinfect regularly, there's lots of antibiotic use. The bugs that do tend to occur there are these superbugs, and there are bugs that are more resistant to antibiotics. So when you do get them, they tend to require like the all-out antibiotics, like the best ones that we've got, and sometimes they can still be resistant to those. So that's why hospital-acquired pneumonia, depending on the presentation of the person, but usually has a tendency to be a little bit more severe. And then in the community acquired pneumonias, again, you would split somebody up is it, quite a mild pneumonia, as in like, can it be treated at home with oral antibiotics? Is it sort of borderline, or is this somebody that requires a hospital admission?
So I want to back up for a second. A lung infection doesn't necessarily have to be pneumonia, but it could be pneumonia.
You're talking about, you're sort of splitting hairs, James. Whenever I hear someone's got a lung infection, and you're just talking about a bog standard lung infection, whether it be like a viral, bacterial, more typically bacterial, I tend to refer to that as a pneumonia. Yeah, okay. That would be what I tend to refer to. But then you've also got like other types of infections like Legionella, like more specific ones. But these are, again, the sort of, it's not a pneumonia, but it's still a lung infection. So it's kind of a bit of a muddy term. If somebody says pneumonia, my first thought is that is a lower respiratory tract infection, which basically means a lung infection, but it doesn't mean that everything is a pneumonia. There are atypicals that will have their own name and their own presentation and be a little bit different. For instance, something like whooping cough isn't a pneumonia, but it is an infection of the airways and the lower respiratory airways. So it's a bit...
Yeah.
It's a bit different. And they have and as well, even within the pneumonias, they won't have there'll be x-rays and you'll look at it and go, that's a typical pneumonia, but there'll be others and you'll think that's a pneumonia, but it looks like an atypical type pneumonia or mycoplasmic pneumonia or fungal pneumonia. It's
fungal.
But then there'll be others.
Fungal pneumonia? You can get fungus in the lungs? Well, I guess it's
Yeah,
a
you
wet
know
warm
that
environment.
you love
Yeah,
your mold, James.
I
You
know.
love talking about mold and
I never thought about it in the lungs, but now that you mention it, it's just a hot, sweaty place, isn't it?
yes. Well, yeah, the lungs are a really wonderful environment for bugs to manifest. But because I mean they're wet, they're
Yeah.
warm, so why wouldn't you? And then you've got all this mucus in there, which is why people that smoke are particularly
Ah,
susceptible to infections because they don't clear mucus from their lungs. So whereas you and I, who've never smoked, our ciliary hairs are still working, so all this mucus is being moved out regularly from our lungs and got rid of by the acid in our stomach. For people that smoke, their hairs don't move, mucus accumulates, or they actually in sort of a severe bronchitis, which again is a side effect of smoking. They actually have increased mucus productions. They have increased goblet cells, which make more mucus, and then this mucus is there to catch bugs. But if you don't get rid of it and it just stays there, well, you're asking for trouble, aren't you? You're asking for infections to brew. What a wonderful environment for them to
yeah.
decide to grow in.
So what do we do? How do we? What is your advice on trying to protect against, a bronchial infection, a pneumonia? What is there anything we can do, or is it just hope?
No, I mean, there's obviously things you can do. And the number one biggest thing, what I'm going to say, is the biggest thing you can do to protect your lungs is not to smoke.
Mm,
And that doesn't just mean cigarette smoking. That means cigarettes, marijuana, shisha, anything that is like an inhalation gas into your lungs is usually just to some extent toxic to the lungs. And the problem is with that is because it is something that irritates the lungs, it causes an immune response. And by the immune response, you get increased mucus, you get increased things like proteases and macrophages. And these are all just like special names for immune cells that basically start to break down the lung tissue and
mm.
also the capillaries, so the blood vessels that supply the lungs. And these have endless issues and basically predispose you to catching infections.
Is
For
is
some
there an
people,
is there an age where these kind of things are more prevalent, or young, middle aged, old aged, or is it sort of equal opportunity?
just as you get older, just generally as you get older, because the more damage that you've done through smoking, or the longer that you've been smoking, and the more that you age, the more likely these things are to happen. And think about, a child can knock off illnesses quite quickly. It's a little bit more difficult as you get older. And there are some people that it's not their fault. It's not everybody's fault. People with asthma have also got issues with lungs and recurrent infections, sometimes more so just with general asthma exacerbations, but they can get a very resistant type of lung tissue, which traps gas and has its own problems down the line, which then predisposes to things like infections, etc. But it's not their fault that they were born with asthma. People with something called alpha-1 antitrypsin deficiency, these are again people that can go on to develop something called the COPD, chronic obstructive pulmonary disease, which is a huge precursor for seasonal pneumonias, infective exacerbations of whatever kind. And again, it's not their fault. They were just born with genes that just weren't working as well as they could have been. And so for some people it's just not their fault. And with regards to sort of our behavior, what can we do? Keep fit, keep healthy, keep your lungs utilized. The more you utilize your lungs by taking nice big deep breaths, that plays wonders for your lungs, because you're encouraging all your bases and all the alveoli to encourage air to come into them and be used properly, not to allow stagnation of the lung tissue, which is where like infections can brew, and eating well, etc., and not forgetting to wash your hands.
Is there anything I can do sort of to ward it off? And I'm kind of thinking here, when folks have asthma, they take salbutamol and they take the puffer, and is there anything we can do to help build up resistance in our lungs and help to, in a sense, protect them beyond breathing deep, not smoking, trying to live in the least polluted environment, that kind of stuff? Is there anything, or no?
I mean, with regards to a supplementation, vitamin C has always been known to sort of help boost the immune system, but otherwise not really, James. it's one of those, if somebody has got lung disease and they're known to have it, or they're experiencing shortness of breath, they should be going to the doctor, because they should be on long-term treatment. So there are medications like inhalers, sometimes oral medications, that will help the integrity of their lungs and stop this mucus production, or try and reduce it a little bit. Sometimes physiotherapy for these people can be helpful, because it can help them to learn how to clear their lungs manually. But that's something that was somebody that's already got established disease. So if we're just, Billy Joe walking down the road, what should they do to help their lungs? Just keep fit and healthy, maybe take a vitamin C supplement or a multivitamin. And I think that's it, really. It's just more about just keeping yourself fit and healthy and active.